Knock knock.
Come in.
Okay, I'm closing the door for privacy. Hello, good afternoon. My name is Fadet, and I will be your student nurse today. I am doing some hand hygiene, and I am putting my glove on. Alrighty. Can I please have your first and last name?
My name is Carl Rogers.
Okay. Can I have your date of birth, please?
March 15.
March 15. Do you have any allergies?
No.
No allergy. And I have MRN number 771-8854. Thank you. Mr. Roger, I'm here to do a head to toe on you. Is that okay?
Yes.
Okay, I'm gonna start with a set of vitals. Okay, and for your blood pressure, I have 125/78, and I have temperature. I'm gonna check your temperature is all. I have temperature 98.4, and I have heart rate 85, and I'm gonna do respiration. I'm gonna listen for 1 full minute for respiration, and I have respiration 20. And I am gonna check for your O2 saturation. Make sure that you got your pulse oximeter in, but it is 97% room air. Alrighty. Mr. Roger, do you have any pain?
Yes.
You do. On a scale of 0 to 10, what is your pain level?
3.
3. Where is your pain located at?
Right here.
Right here. What does the pain feel like?
It is a sharp pain.
Sharp pain. Does it radiate anywhere?
No.
What provoked your pain?
Touch, like if someone touches my feet.
Okay. Anything make it better?
Like medication makes it better.
Medication. And whenever we finish your head to toe, I'm gonna check in the chart to see if you have any PRN medicine, any medicine order for your pain. Okay.
Okay.
Alrighty. I'm gonna start. Do you know where you are right now?
Yes, I'm at Fortis Hospital.
Do you know why you're here?
I'm here for high blood sugar level.
High blood sugar level. And yes, I did check and see that you had a order for blood sugar check stat, and I'm gonna do that also. Do you know what today's date is?
Today is October 16th.
October 16th. Okay. I'm gonna start in your pupil. I'm gonna start looking at your pupil, and I'm gonna look at the both pupil. They round, equal, reactive to light, and perla is present. And I'm gonna have you look at the pin. Just look straight at it. I'm gonna go straight to your nose. Accommodation. Okay. And now while I'm here, I'm gonna look inside your mouth. Inside your mouth is pink, moist, and everything looking tight. All your teeth. Okay. Mr. Wilder, do you have any cough?
Yes, I do.
What color? Is it productive or non-productive?
It is productive.
What color is your sputum?
White.
White. Is it thick or thin?
10.
If I give you a little cup, like a 30 ml cup, will you fill it up?
5 ml, I would say.
5 ml? Okay. And now I'm gonna pull down your gown. I'm gonna check for skin turgor, and it's not tinting. And now I'm gonna check the temperature. Your skin is warm to touch and it's dry. Your skin it look appropriate for ethnicity, and skin look intact, no lesion, no scar. Okay. Now I'm gonna assess for your chest. It looks symmetry, and it looks like your respiration is even, is rise and fall is even, regular rhythm, and now I'm gonna auscultate to listen to your lung sound. Okay.
Yes.
I'm gonna do eight position up front and 10 in the back, and I'm gonna do the zigzag modification. I'm gonna start. I'm gonna go over here. Okay, I did 8 position up front, and I'm gonna do 10 in the back, and then I did 10 in the back, this exact modification, and lung sounds was clear, and your respiration was normal, unlabeled, and it wasn't shallow either, it was regular. And now I'm gonna listen to your heart sound, okay?
Yes.
I'm gonna start on the right, second intercostal on the right, and I'm gonna listen to your aortic valve, and I'm gonna go on your second intercostal on your left. I'm gonna listen to your pulmonic valve. I'm gonna come down to your third intercostal on your left for your Erb's point, and I'm gonna come down to your fourth intercostal on your left for your tricuspid, and I'm gonna do the mid-clavicular fifth intercostal on your left for your mitral valve. And I'm also gonna turn my stethoscope to the belt. I'm gonna listen for 1 full minute for your apical pulse. And I listen to a whole full minute, and apical pulse is 85. Okay. And I heard S1, S2. I didn't hear any extra heart sound, no murmur was noted. Okay. And now I'm gonna check for your pulses. I'm gonna check for your brachial pulse bilaterally, and they were +2. And I'm gonna check for your radial pulse bilaterally, and they were +2. And also I'm gonna check for your capillary refill, less than 3 seconds. And now I'm also gonna check for strength. I'm gonna push, they were +5, and I'm gonna pull, +5, and I'm also gonna squeeze and grip my hand, is +5. And now I'm also gonna see if you have an IV site. An IV site look intact, no redness, no infiltration, and I see the dressing look intact. There is also a date, and it's today's date, with the appropriate date, and the nurse who changed it initial, okay? And I will also flush to see if it's patent. All right, and now I am gonna come down and look at your belly. All right, I'm gonna look at your abdomen, and your abdomen look flat, and everything looks symmetry. It doesn't look like you have any mass or bulge, and skin look intact, no lesion, no scar. And now I'm gonna auscultate to listen to your bowel sound. I'm gonna listen to your bowel sound in all 4 quadrants, and I'm gonna start on your right lower quadrant. I'm gonna go up on right upper quadrant, and I'm gonna go left upper quadrant, and I'm gonna come down to left lower quadrant. And bowel sound heard in all 4 quadrants. And now I'm gonna palpate on all your quadrants to feel for any mass or bulge or anything. Let me know if you feel any tenderness. I mean, if you feel any tenderness or any pain, okay? No pain, no tenderness?
No.
Okay, thank you. Mr. Wadri, when was the last time you had a bowel movement?
Let's see. Last night.
Last night? What was the color of it?
Brown.
Did it have any special odor to it?
No.
What was the consistency of it?
It was like soft.
Soft. What would you say the amount? Large or small?
It was a medium.
Medium? Okay. Did you have anything to eat?
No, I didn't eat anything this last night, but I did eat breakfast this morning.
You ate breakfast. Did you eat 100% or
some? I would say 75%.
Did you have anything to drink?
Yes, I did. I drink water because since my blood sugar was high, I didn't want to add to my sugar.
Okay, so you just had water. What would you say, like an 8-ounce water?
Let's see. I would say like 220 ml.
220 ml?
Yes.
Okay, thank you. And now I'm gonna come down to your genitalia. I'm gonna inspect. I don't see any lesion. I don't see any sore, edema, any discharge, and I don't see any presence of abnormalities. Mr. Wadri, when was the last time you urinated?
2 hours ago.
2 hours ago? What was the color of it?
Straw color.
Did you have any odor to it?
No odor.
What was the cloudy? Was it clear or cloudy?
It was clear.
What would you say the amount of it?
It was about I mean, if you give me a urinal, I will say like half of it.
Half of it. Do you have any pain when you have to go?
No, I don't.
Do you have any urgency?
No urgency.
How frequently do you go?
I have the same frequency like I usually do.
This one frequency? Okay. Thank you. And now I'm gonna cover you up and make sure I respect your privacy. And now I'm gonna come down to your lower extremity. I'm gonna touch your legs. It's warm to the touch and it's dry. Skin look intact. And color look appropriate for ethnicity. I don't see any scar, no lesion. Okay, and I'm also gonna check for edema. I don't see any edema, but I do see you have like a wound on your right heel. I'm gonna check for the wound to see if the dressing is intact, if there is any, if it's saturated, because I see that you have an order to change your dressing. I'm gonna do that right after we finish. But I'm gonna check also to see if there is a date on it and the time and the last nurse initial who changed it. Okay. And how is your heel feeling? You say you have pain in it?
Yes.
Okay. We're gonna make sure is because I'm gonna check for your pulses, your pedal pulses and your tibial pulses. Is it okay if I touch that feet?
Yes, ma'am.
Okay, I'm gonna check the top of your feet for the dorsalis pedis pulse, and I'm gonna go on the inside posterior tibial, and I'm also gonna check for your carpal field. It's less than 3 seconds, and I'm gonna push is 5 plus 5, and I'm gonna pull for strength and it's plus 5. And now I'm gonna remove my glove. I am gonna do hand hygiene. I'm gonna put another pair of gloves. And now I will make sure that after I put my brand new pair of gloves, I cover my patient up. Make sure that he's comfortable. And now I will be doing a blood sugar check for you, Mr. Wadri, to see how your blood sugar is. Let me remove my glove. I'm removing my glove. I am doing hand hygiene again. And then after I do my hand hygiene, I will make sure that I have all my equipment. And when I'm doing my blood sugar, I have a paper for me to put my stuff as a barrier. Once I do that, I have my alcohol pads and everything. I'll make sure the machine is working properly, and I sanitize it before I do so. And I will ask the patient which finger he prefer, and I will take whichever finger, maybe like the middle finger. I will take the side of the finger, and then I will wipe it up with the alcohol swab, and then I will stick him with it, and then I will wipe out the first drop of blood. And now I will take my monitor to get the blood so I can check the blood sugar, and the blood sugar was 263. And now, because I have insulin order for you, Mr. Roger, I'm gonna look to see what is the unit that I have to give you based on your blood sugar result, okay? And then we're also gonna take care of your pain and change your dressing. And now I'm gonna make sure that the bed is at its lowest position. The bed is locked, but both side wells is up, and I have your call light right next to you. If you need anything, don't hesitate, just press it. Your table is at right next to you with all your items with it. Do you need anything else, Mr. Roger?
No.
Would you like the door closed or open?
You can leave it open.
Okay, I'm gonna leave it open, and now I'm gonna do hand hygiene before I exit the room. And hand hygiene. Have a good afternoon, okay, Mr. Roger?
Thank you.
Okay, thank you.